Hello, everyone, and welcome to the fourth installment in Alan and I's series of questions where we're investigating and trying to answer questions that students and recent graduates have about graduation that hasn't quite been answered and that they're common across the board and students from around the UK and other countries. And today we're covering what CPD courses or wider reading would you recommend to prepare students for the first year as an osteopath? And this is a really great question. It does come up time and time again because people want to prepare more and more and they don't necessarily always feel confident in going into that role. So what do you tend to recommend to people?
Yeah, so what I've done is and I love this question because you can divide it into like professional development and personal development because as osteopaths, we typically go into the self-employed world. And regardless, even if you're self-employed or employed, we always want to work on our clinical and professional development. But from a personal development point of view, if you're thinking, yeah, I'm going to have my own practice or I really want to be the best associate that I can be, then you've got to do a bit of personal development in there as well. And so and all of which are CPD hours, by the way. So make sure you log all that in. So I've split this into personal and professional development. So with personal development, my favorite book ever to do with osteopathic techniques is Laurie Hartman's Handbook of Osteopathic Techniques. To me, it's um, what I love about it is that it's concise. There's loads of picture diagrams, and what I really love is the step-by-step instructions on what exactly to do at every stage of the technique. Everybody has heard of Laurie Hartman, a fantastic osteopath, and I just love the kind of step by steps that you get taught at university as well, being like, first palpate this, then move your hand to this, get this hand contact, and you're looking for this range, you're feeling for this, and so it's really familiar, and I love that about Laurie Hartman's book. So Laurie Hartman's Handbook of Osteopathic Techniques would be number one. It was always on my practice desk, and I would always be flicking through it in between patients. And also, just as a quick little tip, before you actually go ahead and treat patients, you're obviously revising about what it is you're going to do during the consultation. I always, come to treatment. Okay, maybe I can try this technique. Maybe I can try something different and, try and upskill myself on this particular technique that I've been trying to get really good at recently. So that's always a clinic. It's always on my desk at that point. Um, the second thing to do with professional development is you always want to continue two things. Always, you want to continually develop your anatomy knowledge, as my anatomy lecturer, Terence McSweeney and Clive Tilbury used to tell me, is that it's all about your anatomy. And if you can trace things back to anatomy, you won't go too far wrong with trying to figure out what's going on with the patient. And so you want to go for your anatomy, continually develop that. Any anatomy book would be good for that. Stone and Stone, go back to your original, is really good as well. But with communication, I think that there's so much great CPD out there with patient communication, but the one that really stands out to me is Dr. Oliver Thompson, which, got a fantastic Words Matter podcast, and there will be some things in there that challenge you about that not everything to do with osteopathy is hands-on care. It's all about how we communicate both verbally and with our body language. And I feel like Dr. Oliver Thompson draws a lot of experience from the evidence-based world, and it will challenge you, and it will go against some concepts that you may have been told. But I think that's the brilliant thing about being an osteopath, is that you can have open ears and be open-minded about what other people's opinions are, and just cherry pick what you like and make your own mind up. So I would highly recommend continually develop your anatomy with any half decent anatomy book. Communication, go and start listening and make your way through what would probably be hundreds of podcast episodes that Dr. Oliver Thompson has got now. So dive into that. Before I move on to personal development, do you have any favorite books, Dan, or any professional development CPD courses that you might have taken?
Yeah, I think I'm going to dodge your question, and I'll actually say that often I think one of the problems that students have is that they're not trusting in their confidence and in their skills that they've been taught at university. Whereas in reality, you may never feel ready, but you are ready. Like you are enough. Like you've done the training. If you've passed the 4 years, then you are ready. Like you have all that you need. You don't necessarily need to spend lots of money doing these courses. Imposter syndrome is incredibly prevalent in the medical profession, and just as much in the osteopathic world. And it's okay to just accept that, you may not feel totally ready, you may not feel totally confident, but you do have the training. And as long as you're giving your patient your best and giving them your attention, then you will be enough. And it's okay to continue learning as you're going. And you will learn so much in your first few years in practice. It's okay not to be at the perfect standard as you graduate, but just trust in your training. Osteopathy in the educational sphere in the UK has come a long way, and you meet certain standards, and those standards have been met by you. So just trusting in that and accepting that you will continue to learn as you go on, and that's no bad thing.
Absolutely. Patients aren't expecting you, no matter how many years of experience you've got, they're not expecting the world from you. Some of them will have pretty high expectations, but one of the best things that you can do is just and be comfortable and confident within yourself to say, I don't know. But to follow that up, if they ask you a question about some medication that you've never heard of, or a condition that you've never heard of, and there's a proper curveball in there, just say, you know what, I'm not terribly experienced on this. But one thing that I pride myself on is actually going home, doing the research and finding out the answers and finding out what the latest is on whatever it is that they've asked. And just say, I don't know, but I'm going to go find out. And then when I see you in your next appointment, I'm going to tell you everything that I've got. Maybe I'll send you an email before your next appointment, and we'll go through this together and work with the other healthcare professionals that they might be working with, and we'll work on this together as a collective. So they feel supported. They don't feel like they're just at it alone, and that you're willing to collaborate with the other healthcare professionals that might be a part of their care. So that is something that's very important to me, is just to own the fact that you're not going to know everything, and that's fine.
Yeah, absolutely. And what other books may you recommend in terms of personal development?
Yeah, so this is where I really get into my element, right? Is because, when I first got fascinated because within Swansea University, where I graduated from, business and management is integrated within the curriculum, which is quite a rarity. It's starting to come in with some universities now, which I think is great. But I've always believed that no matter whether it's integrated within the curriculum of the universities or not, I thoroughly believe that osteopaths or osteopathic students should have access to high quality business and marketing material, which is why we offer free CPD. If you go on the website, you can go and get started with some incredible business and marketing orientated CPD if that's what interests you. Personal development, right? It's not just to do with business, right? As you may think, it's also to do with not even just to do with marketing. A lot of it, from what my experience is with combining what I've learned from hundreds of osteopaths to reading and listening to hundreds of business marketing books. It's not just about business and marketing. It's also about productivity, time management. It's about self-development. It's about branding, which if you've followed Osteohustle for any length of time, you know that we bang that drum extremely hard. So it's so for the three personal development books that I would highly recommend, I'll start with the obvious. You can be 1% better every day with Atomic Habits by James Clear. If you haven't already read that book, it's in the top 3 of every single person's things to read on personal development. I'm a big fan of Audible. If you can afford Audible, go on that. If you can't afford Audible, just go onto YouTube and type in audiobook, title of audiobook, and somebody will have an audiobook on YouTube for you to have a listen to. But beyond the obvious of Atomic Habits by James Clear, you can one of my favorite authors is actually the godfather of branding. His name's Marty Neuermeyer, and his concept is don't be better, be different. And read his book called Zag. And his whole tagline with this is that when everybody is zigging, you got to be zagging. So it's thinking differently. And this is even better, not just from a personal perspective, but from a osteopathic perspective of always trying to think outside the box. So not just to do with business, not just to do with personal development, but also integrating with how you're thinking as a practitioner. So that's Zag by Marty Neuermeyer. Really short book as well. And the final thing, and I believe every osteopath should read this, especially if you run your own practice, is Understanding Your Vision and Your Purpose and Your Drive, with Simon Sinek's book, Start With Why. Start With Why, for me, was the link between all of the osteopaths were saying you need to care about your reputation, care about what you're known for, care about the work that you're doing and why you're doing what you're doing. And then all the business and marketing books were saying branding, and branding's really important. I didn't put the two together for a good year. And then I came across Simon Sinek, and Simon Sinek brought those two worlds together. And so if you care about your reputation, if you care about the standards that you set for yourself as a person and as a clinic owner, as a clinician, really understand your vision and your purpose and your drive. Start with Why by Simon Sinek. So if you can read those three books before you finish university or in your first year of practice, you will be years ahead of so many amazing osteopaths, because you're just kind of skipping that learning curve, and that's a really important thing.
Brilliant advice, and yeah, great recommendations. I'd concur with all of them. Awesome.
Perfect.